Yeah. And we are going to get started, and then we'll go through questions at the end because I'm going to answer a lot of your information during the presentation, and then at the end we can kind of go over some summaries and some thoughts from there. So we'll go from there. Let's get started here. Let me see how I'm going to share my oops. Well, I need to get my screen working. Hold on one sec. Here we go. And share. All right. Hopefully you can see there. All right. So we're going to get started here. Basically talking about joint conditions and how we can help with those conditions. And actually a question I get all the time asked, which is should you go overseas to have a procedure done? So let's get started here. So I'm really happy that you are here. Thank you for being here, because your health is the most important asset that you have. Today, what we're going to talk about, who is this seminar really for? How do stem cells work? What conditions do they help? Do they eliminate or how they help with chronic pain? Are they safe? What can you do in the United States? Do you need to go overseas to do a procedure? And how do you really pick the right kind of clinic? This seminar is really for people that have osteoarthritis, that have maybe chronic pain, have limited your daily activities because of it. Maybe you've talked to different specialists because of it. Maybe taking over-the-counter medication or prescription medicine, even considering surgeries. If you are really looking for a long-term solution instead of just a temporary fix, to decrease your pain levels, live without those, feel younger again, spend more time with your friends and families and people that you care about, walk upstairs, do exercise, activities, normal things that you really want to do. This isn't really for people that aren't really ready to change, that don't want to do anything new. They're not open to new ideas, because this is definitely new. So I had a miracle on December 12th of last year. Let me tell you what that means. I achieved something that was told by many experts that was going to be impossible for me to achieve without doing surgery. And what was that? Well, here it is. Hopefully you can see. I ran a marathon. So that was last year. I did half of the marathon. It was a half marathon for me. But I was able to run it. Now, I've never been much of a runner to start with. The reason this was actually a miracle for me is because 10 years earlier, I decided to take up a sport. I don't know if anybody watching remembers doing dodgeball when they were a kid, but I remembered it as a fun sport, and I enjoyed it a lot. So when I was 41, which is in 2011, I decided I wanted to start doing sports again, and this is the one I chose. Not the best decision, I have to say. It's really difficult to make friends when you're hitting people in the head with a ball, especially women. They don't typically like that. So it's not good for dating. Just advice: if you're dating or trying to date, this is not the sport for you. So anyway, in addition to having challenges making new friends, the other problem happened when I went to throw a ball and I landed on my back, not because that I ripped and not because that somebody had hit me, but the reason I landed on my back is because I tore my ACL. I don't know anybody watching has ever been through that experience or is currently going through that. But I had that experience. I tore my ACL. I didn't know it at the time. I just thought I kind of sprained my knee or something, because this was the first time I'd ever had a situation where, my body kind of failed me. And at the time, I had physical therapy clinics. I had 2 of them in Atlanta. I had pretty large ones, and I did therapy on it, like thinking it would be resolved. And The problem was it just wasn't fixing itself. It just kept persisting. I felt weakness all the time. I was always very hesitant on any kind of side to side movements, things like that. So I did the therapy, but it just wasn't fixing itself. And this is kind of when you start to have that realization, oh my gosh, I'm getting older. That's the first time. I was 41. That's when I noticed, because I was always healthy and athletic. So this is the first time my body is not recovering. Anyway, so I finally made an appointment with an orthopedist. That's when I found out that I tore my ACL. He basically said, they did an MRI. They actually did 2 MRIs, and then the orthopedist out of several of them I talked to, and basically they said, yeah, you tore your ACL. That's when I found that out. And they said the only solution that I had was surgery. And they didn't give me any other options. And they told me that they could repair it with surgery. And I was like, oh, cool. All right. Tell me about repair. And they said, well, what we do is we chop off what you have, and then we put in either cadaver tissue or part of your hamstring muscle. And I was like, that's not a great idea, because I like my hamstring and I don't want some dead people's tissue in my body. Either one of those sounded terrible. And, and they connect it, you can see with this picture, like with the little plugs. And so that wasn't what I wanted to do at all. I decided, no, thank you. I had to find a better solution. That's actually when I found stem cell therapy, but this was new. Now, this is 2011. Nope, not really anybody had heard about this kind of procedure, at least doing it for the public for a general practice. Anyway, so it was out of Asia. I was out in Thailand. So I actually flew to Thailand for 3 months, learned all about stem cells. And then when I came back to Atlanta, I was just like, this is amazing. This is the thing that I want to do. And I did it with using placental tissue, actually. I didn't use bone marrow, which is what they were doing there, but they actually had something new called placental-derived tissue, which is where they're taking placenta from, after a woman's had a baby, the afterbirth or the perinatal tissue. They were repurposing that and injecting it. And it was amazing. I got results super quick. It took about 4 to 6 weeks, and I started feeling great. My knee started recovering. And, after 2 months of time, I was back to myself. I didn't have the problem anymore. Everything was just back to normal. I had no surgery. Now, keep in mind that these surgeons told me that the only way to fix my problem was surgery, and I wouldn't be able to run again and do the things that I did. And that's why I said that I had a miracle 10 years later, where I did 1 injection. It cured me. Some people are hesitant to say that. It cured me. 10 years later, 11 years later, I did a triathlon, or I'm sorry, that marathon, and I've never had knee surgery, and I still don't have problems with my knee. So I'm a very, strong testimonial. Because of that, I went through a lot of training. I actually got a fellowship in stem cell therapies back in 2017. I was doing it a lot long before that, but this was when I could first get training, because there wasn't a lot of training. And we started seeing hundreds of patients with joint conditions, and we were helping a lot of people. So that's kind of where I got involved in it. I was so passionate about it. I mean, I wrote 3 books. The new one that is right here, Reprogramming Youth, was published just last year, and it talks about stem cells and regenerative medicine in a simple way that you can understand. And I'm going to tell you a little bit about that today during the presentation. But everybody who stays will get a copy of this book. If you don't have it, I'll send you a digital copy for free, or you can buy it on Amazon for $40. I assume you want it for free, so I'll give it to you. You may have heard of this book, Tony Robbins' Life Force book. Fantastic book. It really kind of reawakened a lot of people to the thought and the ideas of regenerative medicine. Big fan of Tony. I think he's amazing, and I love this book. What's interesting about this book is if you look on page 660 on the acknowledgement section, you'll see I've got this area kind of squared off. And what it says here is, to my amazing healing team. And you see my name there. It's listed in his book. So I was very blessed that he put me in his book. I was very happy about that. So thank you. So let's go into something called osteoarthritis. Joint conditions typically are either osteo or rheumatoid. Osteo is the most common one, being that it is really where the cartilage that is between the bones is wearing away, as a simple definition. So here are some of the symptoms that you'll typically feel. You'll have some tenderness, stiffness, swelling, limitations of movement, weakness, fatigue. So those are the typical symptoms that most people tell me that they have. Now, here's what you go to your medical doctor and they say, all right, the traditional solutions are what? Cortisone, medications, and surgery, right? So we've got cortisone, which weakens your immune system. It affects your sugar levels. You have limitations on how many you can have because it really affects your body, and really it will weaken that area faster than it should be. And it's just a terrible option. I mean, I would not use this because it really destroys the joint, and it's only just a temporary relief, and it doesn't provide long-lasting solutions of any kind. It's just blocking your pain signals for a period. Then there's prescriptive medications. Normally, when I do this presentation, I'll say how many of you have taken a pain reliever in the last 7 days. If you're listening, you can think maybe you have. Have you taken an Advil, a Tylenol, any kind of medication or prescription? The prescriptions out there are hydrocodone, oxycodone, methadone, codeine, morphine. All these are the more prescriptive pain relievers. But if you're taking pain relievers because you have joint pain, that's a never-ending battle. You'll continuously be doing that. Because medications really don't promote health. This is a crazy stat. There's 30 billion over-the-counter tablets sold in the United States. That's like Advil and Aleve and all that. 30 billion a year. Unbelievable. And then if those don't work, then your solution is surgery. Now, joint replacement carries a lot of issues. Now, it's the third most common surgery, costs about 26 billion. There's 700,000 knee replacements, 300,000 hip replacements. About 3.5 of those have serious complications. That's about 35,000 people per year have serious complications, which is a lot. It's risky. The recovery time takes a long time, 3 to 9 months, depending on who you are. And a lot of people just never become back to normal. So complications are common as well. It costs quite a bit of money. Sometimes even your insurance won't cover rehab or lost work or loss of function, pain and suffering, things like that. So there's consequences when you do joint surgeries. And the percentage of people that will have to have another knee surgery after the other surgery is 25%. And there's a lot of people that may not be pleased with their hip replacement or any kind of knee replacement surgery, as you can see with this cartoon. So traditional medical model is really looking at treating symptoms, where the regenerative model is really looking at trying to heal yourself naturally, and do it so that you get long-lasting results. Now, here's my question to you. Imagine this. Imagine what it would be like if you were to travel 6 months in the future from now, say let's say summer of next year. What would it be like for you if you're having joint pain of any kind? What would it be like if that was gone? How would it make your life different? Would you be doing new activities? Would you be running? Would you play more tennis or activities, golf, or anything else? Would it be awesome not to have to take medications? How about wake up in the morning and you don't have any pain? Would it affect your relationships? What if you were to gain 5, 10, 20 years of quality life? What would life be like that if that could happen? So instead of just talking about it, let me talk about the future and maybe making this actually real for you. So now we're going to get into what stem cells are and regenerative therapies. There are really 3 truths that go through 3 stages. When I first started this in 2011, late 2011, I mean, talk about ridiculed, man. People just were like, this is crazy. It doesn't work. It's fake. And then it started becoming like everybody was against it. Like, oh, you're killing embryos and babies and, you're doing all these bad things, which we've never done that. We've never used embryos. We only use placental-derived tissue, which comes from the afterbirth, not embryos. That's before, right after conception, not after birth. And then now it's kind of like, oh yeah, of course, I know stem cells fix everything, right? And now it's self-evident. So that's what we've been through now. So more people are aware that stem cells have a pretty amazing ability to do some healing. So let's talk about what that is. So let's go what a stem cell is really. It's a self-replicating cell. It can make more of itself, or it can create new types of tissues, whether it be blood, ligament, muscle, bone, organ, nerve, things like that. So they're important because they're responsible for decreasing inflammation after an injury and stimulating the replacement of all the damaged parts of the body. So how do they work? Well, here's what we used to think. When I first started this is what we thought happened. You get an injury, the stem cells in that area would jump out and then they would heal the problem. That sounded like that's what we thought. And so we went with that for many years. The problem is there's really different types of stem cells that we were unaware of. There's a master stem cell, which is called the mesenchymal stem cell, which is really responsible for coordinating and surveying an area and determining what needs to be done to correct it. Then you have something usually called progenitor cells or things like that, but they're tissue-specific niche stem cells that create just one kind of cell, like a skin cell. It makes more skin cells, or bone cells make more bone cells. It only makes one kind. So it's the worker cells. So really what happens is you have an injury, you have the stem cells in the area, they become activated, they look at the problem, they take down the inflammation, they send out a bunch of messages of instructions to what needs to happen to be repaired. Then the tissue-specific stem cells or progenitor cells start the repair process. So I'll give you a little visual. So what's happening is it's all caused by these messages from stem cells. So think of it like this. We've got a job site. You got a guy in the middle. He's representing a stem cell, and then the workers around are the progenitor cells. Those are the tissue-specific stem cells that actually do the work. So he determines what needs to be done, and he tells the workers what to do. So think about it this way. Let's say I'm working out in the gym. I'm going to do legs. The stem cells, after I've done these exercises, they come out and they stimulate the repair of the muscle. And that's what's constantly happening in our body all the time when we damage muscle. But guess what happens as we get older? We don't repair as well. And here's why. Because the amount of stem cells that we have in our body, in this case, the bone marrow, goes down dramatically. You can see when you're a child, it's 1 in 10,000. And as a teenager, you're 1 in 100,000, which basically means that you've lost 90% of the repairability of those mesenchymal stem cells in the bone marrow. Then when you're 30, it gets less. And when you're 50, you got less than 1% of the cells have the ability to do repair, and it gets worse as you get older. So the amount of repair cells that we have is just low. Now, currently, we can't quite do this yet, where we just go up to get a new part for our body. We sort of like almost there, but not quite. It's not been indoctrinated into our life yet. So let's talk about, healing our own bodies naturally. So there are 2 main types of treatments available. You've got your autologous stem cells. Now, autologous just means that they come from your own body. You typically, if you're going to do a stem cell treatment that comes from your own cells, it either comes from your bone marrow or from adipose tissue, your fat cells. Allogeneic is the other one. That's the one that comes from somebody else, whether it be amniotic fluid, placental tissue, cord blood. That is from usually someone else. So here's the problem with using your own stem cells. As you can see in this picture, this is a bone marrow aspirate. They've got big needles stuck in the back of somebody's pelvis. It can be painful. It is painful. You got less cells available, especially as you get older. The strength of those cells become less, and the effectiveness are also less as you get older. Now, the good thing about, say, use someone else's stem cells, like perinatal tissue, is you got a lot more available to you. Their younger cells are just going to be stronger than an older cell. It just makes sense naturally. And there's really no surgeries required with that. So now then we talk about, well, is it better to do things in the United States or overseas? So let me tell you the primary difference is the ability to expand the amount of cells that you use. Most stem cell clinics in the United States usually use a lower amount. They use a tremendously lower amount of cells. Let's say 1 to 5 million cells, and not all of them are necessarily stem cells. So you've got a very low, not a very low, but a low amount of stem cells. Now overseas, they don't have the restriction. They don't have the same restrictions as they do that we have. So typically, if you go to another country, they're going to use millions, 100 million, 200 million. They got a huge amount of difference because they just have this different restrictions. So that is the primary difference between using a stem cell clinic here as well as using one overseas. Now, what I found is most of the overseas clinics typically use placental-derived cells. They're not usually doing the surgical procedure. They're doing the stem cells from placental tissue. And then they're taking those cells, filtering out the mesenchymal cells usually, and they're expanding those into a large quantity. And that's usually what a stem cell procedure from overseas is doing. So the problem with doing any therapy, whether it be in the United States or overseas, is that you as a consumer do not know what you're getting. And you can go to the best doctor in the world, but if they're buying placental-derived cells that are all dead, you're not going to get a result. And or if you go overseas, you don't know if that lab or clinic is using real product. You just don't know. This problem's been around for a long time. When I got my fellowship, I decided to buy a machine that actually would count the cells. And here's an example of what you can see on imaging. And what it does is it looks at all the cells, it'll determine viability. So this is just some numbers that you'll see. But what it tells me on this one, it says that about 1.18, which is 11 million nucleated cells. That just means cells that have a nucleus. And the viability of those cells is about 77%. See, the problem is your provider, your doctors are not going to do this. They're not going to show you this information from the product that you're using. It's just because it takes too long. So you don't know if you're actually getting what they say you're going to get. So you're paying a lot of money and you never know what you're going to get. So I would actually go to clinics and test their product. And that's how I know that many of the products that I've done in the United States have been fake. They've had dead cells or fake product, and the doctors didn't know. So you got to be really careful with that. So there can be tremendous benefits with these procedures, but there's a lot of risks that go along with it, especially as a consumer. So what are the benefits to doing it? If you get a good procedure, is it can really help you heal. You'll heal the areas, it'll take down inflammation, it'll stimulate the nerves to function, it'll actually just activate your body's healing ability. And that's really what we want to do. And it helps with a ton of conditions, but since this seminar is primarily on joints, we talk about arthritis, osteoarthritis, elbow, knee, hip, Achilles. You've got muscle sprains and strains, tennis elbow, Achilles, ACLs, like worked on me, pelvis pain, instability, even spinal degeneration. This is one of my first patients back, almost, 10 years ago. He had a procedure, and I'll let him hopefully tell you.
Okay.
Yeah. There you go.
If you would introduce yourself.
I'm Leslie Caldwell, and I've been a patient here for quite a few minutes.
And so what are we having done today?
We're having stem cell injection.
And tell us a little bit about your symptoms that you're having it for.
It's my knee. It's hard to get up and down because of the pain.
How long have you had problems with your knee?
About a year.
And what are the symptoms that you would have?
Just painful to try to get up, falling down. Hi, I just wanted to tell you that how much the stem cell therapy helped my leg, my knee. I can't believe how much better I feel. I was somewhere between 5 to 8 days, but I had no problem with it. I had no inflammation. It feels so much better now that I've had it. And what can I say? I recommend it.
So that was just one of our first patients that when we first started doing that. But since then, I mean, there's tons of athletes that do it. You know, you got Peyton Manning, Tiger Woods, you know, Alex Rodriguez, Michael Jordan, Rafael Nadal, you know, of course, Tony Robbins talks a lot about it. I actually worked with, I don't know if anybody is a old 90s wrestling fan, but this is Diamond Dallas Page, a very popular wrestler back then. I worked with him. He actually did a little testimonial as well for me.
I'm Diamond Dallas Page, former 3-time world champion professional wrestler. You know, being a professional wrestler for so many years, my body's really beat up, but especially on my knees. And I'm really close to, you know, serious bone on bone. But when I heard the results that Dr. Ross Carter was getting with injections into the knee, I was all in because I wanted to try this. Within 4 days, I was right back to my regular routine. And so far, it's been about 3 weeks and I'm feeling pretty good.
So that was Diamond Dallas Page. So, you know, now it's something this is really available for you if this is a route that you want to take. You know, I've given you some information and I'm going to answer some questions, but, you know, even, you know, having knowledge is good. It's helpful, but it's not really power. It's, you know, Tony talks about this all the time, right? Knowledge with action is real power. When you take your action is when it happens. And it starts with a decision to do something different than you've been doing, because insanity is doing the same old thing, the same old way. And if you're wanting to know maybe what you can do yourself, you know, that's what I'm here for. There's one more, this is Linda. She wanted to tell us this.
For about, I guess, 3 or 4 years, I've been having really bad problems with my knees. The worst problem is that it would jump out sideways. And I went through physical therapy and several things to try to make my knees feel better. Both knees actually were hyperextended in an accident. So that's what was bothering me most. I was having trouble hiking. I couldn't run. And the thing that disturbed me most was going up and down stairs and the pain that I was having in my knees. I actually felt like I must have been about 80 years old, walking one step at a time, holding onto the rail for dear life, even looking at a one-story house. But came here, got the stem cell shots, and I'm not kidding, within 3 to 4 weeks, I feel like I'm my age, if not younger again. I can move up and down the stairs at will. There's no grabbing. I can even carry things up and down the stairs. It's absolutely thrilling, and I can't wait to see if I can run as well as do some hiking again. And I feel very confident in moving. Very happy.
So as you can see, we've had some wonderful successes. So here's some questions that I typically get asked, and let me answer them. So here's 10, but we can also handle any questions that you have after we're done here. So I will ask you guys, how many treatments does it take typically? Well, that's really based on what's being treated and what the condition is. For a joint, typically, some people can get away with one, but sometimes it might need more. It's based on your body's ability to heal itself. So what we're doing is we're stimulating your own body to heal. It's not magic. It's just stimulating your own system, which is kind of, you know, as you get older, your repair system slows down, and we're turning it back on, or trying to. So it's really difficult to say how many it'll take. It only took me one, but for other people, it might be more. So there's no real way to answer that question definitively. Now, does it work on bone conditions? I get that a lot too. And yes, it does. A lot of people still have some cartilage on a bone condition, even though you can't really see it much on an x-ray. But if you can take out the swelling and inflammation, even those conditions can improve. There's no age limit, and there's no surgery if you do the placental. Now, if you do the bone marrow or the adipose, there is those surgeries. And those procedures are also effective. They're just different in the way that they work. Does it hurt? Well, if you have a surgery, then yeah, that's painful. The procedure is an injection typically, so that's as much as it hurts as an injection. How long does it take to see results? You're talking usually a 2 to 4 weeks to start to feel a difference. But sometimes depending on your condition, it can take 3 to 9 months. But usually we like to see results in 2 to 4 weeks. What are our results? We've seen a lot of the most common conditions that get great results are like shoulders and knees. Spine and hip are less, the results are less than ideal, just because they're a very difficult joint to work with. Should you go overseas? Now let's go into that question. Sometimes you will need to go overseas. So if you have a somewhat non-complicated case, let's say a joint that's just a little damaged and it needs a little acceleration and healing, then a lot of times you can do that here. You can use some Wharton's jelly or some other type of placental derived tissue product. You can actually use your own cells as well. And you can, sometimes that'll be enough. Now, for some people, they have pretty significant problems and they need a lot more cells, and you're just not going to really get that here. So that's when you would consider going overseas. But like I said, you never know what you're getting with a lot of these clinics. I can help you with this, but I'm just letting you know, you just got to be careful. Cost factors. What is the cost? I'll go through that as well. So what determines your results is really your lifestyle. If the better results are going to come if you're not smoking or not drinking, if you're exercising, these things are going to make a difference in your results. If you're under a lot of stress and not sleeping, overweight, you're in a toxic environment, it's going to make it difficult. Activities, if you keep doing the same thing that caused the problem, it's probably going to come back. If you don't do any rehab or anything like that, and the amount of damage really determines your results. Here's the cost. Stem cell therapies can vary greatly based on where the procedure is done. It can be anywhere from $5,000 to $25,000 is kind of the range that's seen across the country and across the world, really. The primary factors, there's more, but this is the primaries, is which joint you're going to treat, how much damage is done based on an X-ray and MRIs, how many joints are done at the same time, what type of stem cells that you do, and where you do your procedures. That really determines a lot of the price factors. So here's the thing. If this all it did was decrease your pain by 50%, it doubled the quality of your life, eliminated your need for using medications, and prevent you from having a surgery, is that worth it? That's up to you. So if you want to find out, let's say you're curious about if this will help with you. I know everybody has their own situation in case. I've given you a free 20-minute conversation with me. I'll sit down. I'll talk with you personally, and we'll answer any questions, and I can guide you and make recommendations. So, there are clinics that I feel are good quality. They get good quality products, not only in the United States, but also overseas. I do know some clinics that I feel do a great job, and they really help. So let me go back on live here, if I can. Stop sharing screen. All right, so you can see me now. I am going to, if you have a question, type it in, and I'll pull you up, or your sound so you can talk. So if you have a question, James had written something. Let me see if I can unmute you. Let's see. James has to unmute. All right, James, you're back on, man. Did you have another question?
Yeah, so I get I have to go to the chiropractor. Pretty much I go once a week, but basically it's to pop my neck. And what happens is it starts building up if I don't go once a week. I get sudden shocks. And then
when you go to the chiropractor or just in general?
Oh, I'm sorry, in general.
Okay.
And then I have to go with the chiropractor to, so that doesn't happen. I don't keep getting those sudden shocks like in my neck. But
Got
it's
it.
like an electrical shock or somebody, it feels like somebody will zap me. If I turn my neck a certain manner or in a certain way. And then every once in a while my neck will get stuck. So I have to like, yeah, so I don't know if that has to do with the neck or the shoulder. But I do have to go to the chiropractor for that same purpose, or once a week or twice.
All right. Okay. So now you're talking about neck problems, I'm assuming here, based on not just joint conditions. So are you asking if it might help with the problem with your neck?
Yes.
Yeah, there are doctors that specialize in joints. I'm sorry, in spinal conditions, and they do work with that. I am not I'm not an expert in spinal conditions, just because I'm not an orthopedist that goes in and does spinal injections. So that one is, what I could do is I can send you to somebody that knows all about spinal things, and they could talk with you then about that. So
Okay.
that's how I would handle that. All right, so let's go to anybody else. We got Dr. Barnett, who just joined us. Hi. Anybody have any other questions that are on the, if you want to type it in the chat, I can unmute you. Who? Do we have anybody want to ask a question? Huh? Who? All right, I am Vivian, Stephen, Ranja. If you can chat a type, I will take your question. Well, you know what I'll do? What if how does it work for AC joint surgery? Oh, injuries. I'm sorry. Why did I read that wrong? How does it work? Well, the whole goal is to stimulate your body to heal faster. So if you've injured your joint, and it can stimulate the healing of the soft tissue as well as the hard tissue, depending on what kind of injury you had, it can just accelerate your own body's ability to heal it. Now, like I said, the results are going to be based on your own body's healing ability. I mean, if you are strong and healthy, let's say you exercise, you eat the right diet, you do all the right healthy things, then it can help tremendously. Now, if you are not taking care of your health like you should, then that's gonna have a severe, challenge. You're not gonna get the best results. So, so that's basically, how it helps with that. Does it help or increase sleep quality? It can. Depends on what's causing a problem. Well, let's say, I don't know if you're having sleep problem or not. Does it help with sleep? Yes. I prefer things like exosomes, which are signaling molecules. They're growth factors they can be from stem cells, which they're commonly from. They're non-cellular, meaning they don't have a cell. They don't typically get any problems with rejection or any problems like that. They circulate through the system very well. It can help your body sleep. A lot of times people have inflammation, chronic inflammation, that can cause them problems with sleeping. And if you take down that inflammation, that will help with your sleep. That's just one thing. Now, there's a whole lot of other areas that we look at. I do help people when they need help with their sleep, whether that be look at, working on your circadian rhythm using blue blocking glasses, or if we're looking at your oxygen levels during the sleep. So it's not just typically one thing. It can help, but if you're having problems with sleep, you might want to see what else could be going on. Now, is stem cell treatment effective for adhesive capsulitis, like frozen shoulder, and bursitis? Yes. So you've got inflammation there. Absolutely. So it can help take down the inflammation and help that area function more normally. You just think about it this way. One of the ways these procedures work, if you're using placental tissue especially, it can actually change kind of the epigenetics, which is the age of the cells that are being treated. So hopefully, if it allows you to heal like you did when you were younger, because after we get older, our body just starts to, we get rusty cells, basically is what happens. And the ability of our body to repair itself is just less. And these procedures are the whole idea is to stimulate your body to heal faster. All right, I see a hand raised. I'm going to take that one. You can lower your hand, ask to unmute. Oops, did I unmute you? Oh, what happened? There she is. Ask to unmute. There we go. You're
Hi,
unmuted.
Raj. Yeah, hi,
Hi.
both of you. Nice to see you.
Yeah.
I have two questions. So, what is the common treatment you treat for? I mean, issues, I would say, sorry, diseases, or what is the common one you work with? What is your average client? And second, how does stem cells work with cancer, for example? Not that
Great
I have it, but I'm not trying to manifest it. But
Yeah, no, I gotcha. All right. So what are the common, well, actually, when I was in practice in Atlanta, our practice was predominantly joint conditions, knees, shoulders, and hips. So that's what we worked with for eight or 9 years. Since I moved to West Palm, there's an orthopedist that I refer clients to, and he does all the joint conditions. So if you're looking for like joint injections from us, this area, then I would recommend that you see the orthopedist here. The things I primarily work with is actually longevity, anti-aging, and working on cellular age. That's kind of my specialty is longevity. So what I do primarily is I work on using exosomes. So the reason our bodies age is actually the cells start to have minute malfunctions because it starts to turn off. It's called methylation, and it's just the expression of our genetics start to change, and the cell slowly starts malfunctioning, and that's what we see as aging. What I do is I use different tools like exosomes to help reprogram cells into more youthful states. And so we can actually measure that by looking at your cellular age, like through a blood test. And if anybody is going to be at the Date with Destiny event coming up in December, we're going to be doing tests December 1st for aging. So if anybody's here for that, we'll be doing that. But what I do is I test your age, then we do procedures or recommend different procedures, and then we retest you to see how much your age has decreased. So that's primarily what I work with. Now, you'd ask about, wow, you can't even see my thing. Here it is. I should scoot over. There we go. So, so you would ask about cancer. Now, cancer, they're using stem cells for cancer now. There are studies, and since cancer's tricky because you have to really actively monitor it a lot, and with the typical med spa or a doctor's office or a clinic, they don't have that ability. So it's usually not advised to do any kind of cancerous procedure at any of these kind of spas or providers unless it's under a study where they monitor. Now, I will say that there's a clinic that is doing some really interesting work. Apparently, the dendritic cells, they're using dendritic cell immunotherapy. What they do, the dendritic cells is kind of in charge of your immune system. Okay. And so they biopsy a cancer. So it has to have a cancer that can be biopsied. They introduce the cancer, the biopsy, the cells to the dendritic cells and train it what to look for. Now, somehow they also do that in the body. They stimulate the immune system, and then the immune system is now attacks the cancer. And it goes after the cancer and it starts killing the cancer cells. So it's your own, there's no outside thing. There's no radiation. There's no anything like that. It's only your immune system that's been stimulated and educated on what cells to find. And then it puts it on high alert, and then they start attacking that. And apparently that is, it's a 6-week process they do, but apparently it gets miraculous results on tumors. So that is a natural way to fight cancer without radiation. So that's what I would say to do. And I wouldn't recommend any kind of normal stem cell treatments for cancer, because cancer could metastasize. It could get more cells to change. If you're injecting a cell that stimulates growth, you don't want your cancer to grow. So I would be very careful with cancer and stem cells. That's why I like this other therapy. So thank you for your question. All right. I don't see any other hands or messages. I'm looking in the chat. I don't see any more. I did all those. All right.
Maybe it's working.
All right, let's see. Yes. Okay, let me pull you back up. Hold on a second. I gotta find you on the little thingy. All right, go ahead.
Sorry, Rob. How do you, because I know there's a different ways you do stem cells treatment, some being directly into the bone marrow and some is being injected in your arm. So what is the way you do it? Secondly, what is the cost of the test you do at David Distant, the blood test?
All right, so how do you had said different procedures? You said inject it in the bone marrow. Are you talking about using bone marrow stem cells?
Yeah.
Or inject into the bone marrow? Because you don't, that would be for somebody that say wants to restart their immune system that has maybe leukemia. That's how they do. Let's say somebody has leukemia, for example, they usually irradiate the immune system, destroy it, and then they inject some type of stem cell into the bone marrow to start the process of developing an immune system again. So that's, I think that may be what you're referring to. If you're wanting to use your own bone marrow, then you go into the back of the hip and they pull out the bone marrow, and then they separate the cells and they can inject that into a damaged area. It'll use your own body stem cells to stimulate a healing. Of course, there are some limitations based on how strong your cells are that can work with that area. So sometimes they're just not strong enough based on your health and things like that. Then you asked something else. What was the other question?
What is the cost of the blood test you're going to do with David Distant?
Good question. There's going to be there's two tests that the one that we're going to be doing is I think it's around $700. It's an epigenetic test. I'll have the price when I have it, because I'm going to buy a bunch of tests, so I'll get a discount. But it's going to be in that vicinity, $600-700, somewhere around there. And all we'll do is we'll do like a finger prick, and then we'll take a little cardboard thing, and you just fill up a little circle with the blood. Really simple. And then we'll send that off, and that's the most accurate test we can use to look at not only it'll look at a lot of things. One, it'll tell me how old you are in terms of cellular age, which is more important than your biological, that's your biological age, not your chronological age. Second, it'll look at how strong your immune system is functioning. We'll also look at how fast you're aging at the moment you're doing when you do the test. So we can look at your lifestyle and it'll let me know if the lifestyle that you're doing now is helping you or hurting you. So it really can tell a lot of that. It can also tell us your telomere length, which is also used for age. So it'll have a lot of different genetic information that we can really look at how you're doing with your health and how fast you're aging. And then and then based on those tests, we can figure out, okay, how are you doing? If you're doing well, then great, keep doing what you're doing. If you're not doing so well, then maybe it's time we need to sit down and look at alternatives to help solve that problem.
Okay, thank you for clarifying that. Thank you, Ross.
You're welcome. You're welcome. All right, I have David. Can you forward? Yes, I'll be sending out the recording. This recording is being recorded. I'll be sending that out to you. You'll have like a week to watch it. And yes, thank you for the link of it's drrosscarter.com/chat if you want to have a free consultation and talk with me. And I'm basically an advisor. I'm an advisor for you. I want you to have amazing results like I had, because it was life-changing for me. Anyway, let's see. Oh, there's the phone number. It's 561-962-1231. And you can text me at that number. I can't seem to move it. All right. I don't see any more hands and I don't see any more messages. If you got a question, ask me now. Otherwise, we're gonna conclude our evening. Anything? Going once? Bueller? Going twice? All right. Thank you so much for everything. I appreciate you all for listening. I hope I helped educate you on all this stuff, because it can be confusing. Keep in mind, there's a lot of bad stuff out there you got to be careful of. So thank you guys so much for your time. Take care.